You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says nobody should be wearing a loose-fitting denture. We've had her on the program before. She is Florida's go-to implant dentist, Dr. Sarah Jockin. Dr. Jockin, welcome back to the program.
Thank you for having me, Randy.
Now you have all new photos, and you have a stack of them this time, so we're going to have to rush you a little bit to go through those. Now, for people that don't know your practice, like who's the typical dental implant patient?
We generally see two different kinds of patients, Randy. Some that have already lost their teeth and are wearing dentures, and as you said, nobody should suffer through a loose-fitting denture. Or those that have really bad teeth that are either loose or they have infection, and we know we have to take those out. And so we're transitioning those patients from their own teeth to new teeth. And again, they shouldn't wear a loose-fitting denture. They should have teeth that don't come out and chew like normal teeth.
Now, if you have really bad gums, can you still do this procedure?
Absolutely. In fact, we have a lot of patients that have really bad gums. Gums disease is very, very common, unfortunately. And they may not have pain, but they have loose teeth, so they can't really eat anymore. They can't enjoy salads or just go to a restaurant and order whatever they want to order. They think about what they can eat all the time because they're not really able to chew well.
Now, I interviewed you 4 years ago. What's changed in the world of implant dentistry?
So much has changed. Implant dentistry is on the forefront of technological advancement. So we have a great way to now give people teeth in short visits in a convenient setting. But the technology is exciting, and I love my tools. What is most exciting to me personally is seeing how those people's lives are transformed. People come in and they need a solution. They need help. They either can't chew or they have pain. They often can't smile with confidence, and they're looking for a solution, and we can offer that. And seeing people make that step and finally get out of the smile that they hate or not being able to chew what they want to chew, it's amazing to see how giving them a new set of teeth that doesn't come out and feels natural changes their whole life around. So you're asking me what's changed since I last came, and Randy, a lot has changed, but what I think is most important to patients is that it's become a lot more convenient. We can do this treatment in fewer visits now, and we actually have advanced technology where we can print the teeth in the office.
You're printing them in the next room.
And absolutely next door. And I have my lab technicians. I have two lab technicians who we call the tooth fairies because they make your teeth right there. And it's amazing because a lot goes into a smile. It's really the center of your face, and that's what people look at first. So if a tooth is a little crooked or too far forward or not in the right place, you can tell right away. So it's important that we get it done right, and having the full control over the process makes me super happy. But that's not important to the patients. To the patients, what's important is that they wake up and they have teeth in their mouth that look great.
Now, is this true like with the denture wear? On the day of the procedure, they could literally walk in with no teeth, walk out with upper and lower teeth that don't come out?
Absolutely.
Is that rare?
Absolutely. No, we do it all the time. I do it every week, actually. And it just really makes them feel like they're whole again. They not having to take teeth out makes you feel like you're just another human being that walks around and doesn't have to think about their teeth as they smile. Because with loose dentures, they can just fall out when you cough or yawn or smile big because they have nothing to anchor to. But with implants, we're able to secure them so that they don't move anymore. And that just is a completely different quality of life for people.
Correct me if I'm wrong here. How dental implants, even in Tampa, in Florida, and throughout the country, how it's typically done is you go to one place where they do the surgery. Then you go to another doctor's office where they put the teeth on top, and another office where they keep them clean. You do all three parts. Is that why you do it so quickly?
Yes, and what's nice for the patient is that there's no possibility for miscommunication, or one doctor thought something that maybe the other doctor didn't think. Or so when you do it all in one place, it's convenient for the patient, and it's also nice because one person oversees the whole thing.
You say it also makes for a better smile. How so?
Well, because we have it all right there. We have everybody involved right there in that room when it happens. You literally go into the surgery room, you get sedated so you're nice and comfortable so that you don't have any memory of us taking your teeth out or doing whatever we need to do. And then you wake up and you're groggy, but you wake up with your teeth so that your caretaker can, you know, hug you and take you home with your teeth in your mouth just a few hours after you came in without them. It's amazing.
Now, look, we're here in California. You flew here for this interview, but we think of Florida as this healthy place. Are there really that many people? Like within an hour of your practice?
Oh, tons of people. Tons of people. You don't, and bad teeth don't run in certain circles. Everybody can be affected by bad teeth because it's very often genetic. It's not the drug user that didn't take care of their teeth. It's an infection. Well, it could be many things. Yes, absolutely. A gum infection can cause your teeth to fall out, even if they're healthy teeth. They just don't stay in your mouth. Or you could have infection in the teeth. Those are cavities, and that could cause a lot of pain, actually. So then people can't. I have patients who really select their foods based on what will cause the least amount of pain. So lukewarm mashed potatoes is something that I know a patient of mine that was almost her entire diet because she just was hurting.
People wait too long?
Absolutely.
You said they hold on to their teeth too long?
Well,
like people see you on the program and they say that they've been watching you for years.
Yes.
And
there is a psychological component to losing your teeth. It can be hard, and it's scary to go, right? So people are sometimes a little caught in this inaction of wanting to cross that threshold to the smile they always wanted, but they just don't necessarily act, which is understandable.
But it seems painful.
You would think so, but first of all, when we do the procedure, obviously you're not going to have any pain. You're going to be numbed up, you're going to be asleep and comfortable. And then people, of course, wonder afterwards, how is it going to be afterwards? And I, in the beginning, was nervous too as a surgeon, but after hundreds of cases, I have to say it is very simple to control. And people do really well. The mouth is just a place where you have a lot of blood supply, so it heals well. That's how I explain it. At first, I thought I was just a really good surgeon, but in the end, people just respond well to surgery.
How soon can they eat afterwards?
They can eat right away. Now, they can't eat everything right away because
so they take it easy at first.
Absolutely.
But after a while.
After a while, later on, when everything is healed, you can bite into an apple with these. You can eat corn on the cob. You can't eat the bones, but you can gnaw your ribs.
So anything you could eat with really strong teeth, you can do.
Absolutely.
Like even ice cubes, but you wouldn't want to do that.
No, that's the one thing I tell patients. Human teeth aren't even meant to chew ice cubes. So even if you have your natural teeth, you should never chew ice cubes. I've actually seen healthy teeth split because people were chewing on ice cubes. So no, you're not allowed to chew ice cubes. But other than that, you have no restrictions. And that actually allows people to make healthy choices. I have tons of patients who say that they feel better and live better because they can eat better. They can eat salads. They can eat nuts. They can eat things that you're supposed to eat, not just all the high carb smoothies and the stuff that people eat who cannot chew well.
Is this the future of dentistry? That means that dentures as we know them now
won't
exist. Everything will be attached to something.
Well, the people who know about this, yes. The people who know about it choose to have teeth that don't come out. There are tons of people with dentures that still exist, but the newer generation, the younger people now, the baby boomers, are not taking the denture not considering the denture as an option. I wouldn't consider that. Would you consider the denture as an option? No, a piece of plastic that just floats in your mouth and you can't chew with properly.
Well, knowing what I
you
know
after
talking to people like you,
Yeah, you just want to have a normal quality of life and just eat foods by just putting them in your mouth and not think about how you have to cut it up and put it on both sides so it doesn't rock. And when it's sticky, maybe you can't get your teeth apart.
Is that right? This is what they tell you?
Absolutely. People have to think about their teeth as they eat.
But I know denture wearers. They never complain.
Well, they wouldn't complain to you now because they don't want to be like the sap story. They deal with it. People deal with it. But when they make that transformation, when they decide that they're going to change their life, because that's what it is, they come back and they just are. They're different people, Randy. I have stories where patients come in and their whole personality changes so much.
Like they're shy and reserved.
They're shy and reserved. They're like a little wallflower because they feel like the world judges them all the time. And you know what? It's true. You will see some photos where you say, okay, the person before and the person after, even though there's just a couple of weeks between them, if I saw them on the street, I would assume different things.
Like they're poor.
Or on unclean. Drugs, don't take care of themselves, low self-esteem, don't make any money, right, are poor. Probably not so smart, right? People actually think that you're not as intelligent.
Like in the movies, they do this.
Right. The villain always have like bad teeth and thick glasses, and not always, but that really makes people look it doesn't represent their true inner self. And it also has the opposite effect. Once you do have that smile that you've used to have or that you've always wanted, you start shining and
return
your
back to who you
smile
used to be,
right,
possibly?
absolutely, or your true potential that you've never reached, because some people go through life hating their teeth their entire lives, and it kind of holds them back, and they might not think about it all the time, but really in the background they don't really want to smile big because they're not proud to express their smile, right? And that affects everything you do.
Now, look, let's pretend you had room on your schedule.
Yeah.
Somebody watching this,
Yeah.
the worst teeth and gums,
Yeah.
really bad teeth and gums, next week they could have a brand new set of upper and lower teeth.
They
if
could.
you had the time on your schedule.
Yes, they could. Absolutely.
Really? Even
yes,
the day
they
after
could.
tomorrow, maybe.
Well, you know what? It does take my tooth fairies in the lab a couple of days to set the case up, but next week is absolutely doable.
Nice. Let's go to the photos for a second.
Okay, let's do it. So this is Arnold. Now,
right.
Arnold happens to be not my oldest, but one of my older patients. He's in his 80s, and he came in and his teeth were just going bad. Part of it is genetics, part of it is just some medications that he was taking, and so we had to replace his teeth. And I was feeling like I was breaking sad news that we had to replace his teeth. But you know what? As soon as I said, I think we have to take all upper teeth out, actually Arnold's face lit up a little bit, because
right? Okay.
he was immediately envisioning how he could get rid of something he's always hated. Arnold had a dad who had dentures, and his dad always complained of his teeth, and he never liked the appearance of his teeth. And so when we replaced them and we put a new smile on him, he was just, it was like a new start for him, which is
Let's
so
take a look
interesting.
at that after.
Yeah, here,
Looks good.
so
by the way, in the before, he could have had a denture. But that's why he goes to you, right? Because they don't want a denture.
Right. Oh, no. He was not going to he wasn't going to do anything if that meant he needed a denture, because he had that personal association with a denture, meaning all the problems that his dad had, right? Clicking when he's talking, pushing it back up against the roof of his mouth because it'll fall down, not being able to eat certain foods. And so he got his new teeth, and so we did it in one day, right? Arnold goes to sleep, is comfortable, we switch it all out.
What's it like when somebody like this sees their smile for the first time?
It really lights them up.
Okay.
Now, you're a little groggy when you see it for the first time because you're just out of surgery.
Okay.
But I've seen tears, I've seen complete quietness, I've seen disbelief a little bit at first.
Okay.
And then they often don't remember it because it's shortly after surgery, right? Like we're still sedated. That day you're going to be groggy. But
so
the
IV
next
sedation,
day,
you're doing IV
sedation on every case. It is nice to just go to sleep and be there, but not really be there while this happens.
He looks a lot better. What does he like more, the way it looks or what he could eat?
The way it looks, because it has actually changed his relationship with his grandkids. Arnold came in at the 1 week post-op check. We see you at 1 week just to make sure everything's good. And he said, man, my 3-year-old granddaughter this morning, she looked at me and she's like, Grandpa, you have such a pretty smile and you smile so much more. And he didn't realize that his 3-year-old would pick up on it so soon.
Wow.
They're very clever, those little kids. And they pick up on the underlying atmosphere that they pick up. And he was just really so much happier with his smile that he just put it out there in the world. And his grandkids noticed, and his grandkids will remember, and he knows that.
Now, when he walks back in, right, he's back for the week, could you already tell the difference?
Absolutely.
In his personality or charisma?
Absolutely. Actually, one of the dental assistants picked up on it. She said, you know what, when he came for his consult, he seemed kind of grumpy. And it really is true when you don't smile because you don't like your smile. People will think a little bit that you're serious or grumpy and that somehow you have a problem. And so it makes them a little, I don't know, not feeling good about you.
Are you ever surprised at who they really are? I mean, when it's all done?
I am, and I am surprised, and now I'm already anticipating it in the consult. Now it's become a game between us at the practice.
Like you're looking at them like they have no idea how good this is going to be.
I see the potential now because we've done so many cases and we've seen these transformations that people have made for themselves, and it's lovely to see how people blossom. It's almost like a flower. So let me show you this next patient here, Dan. Dan, lovely guy, couldn't really eat anymore because only like 3 teeth were touching here. And it kind of snuck up on him. So he lost some back teeth and then some more, and it kind of wasn't a priority, and then he just needed to do something.
Like on this before photo, because you told me you have to really ask people to smile.
Yes, you do.
They're not used to smiling.
Yes, you do. They are not. They're not used to smiling at all. And Dan was a producer. He was in the TV industry, and but behind the camera, the man who made it all happen, but never in the picture, right? And so now we did his teeth. He did great. Dan is a perfect example where if you have so few teeth and they have to go, the option used to be, well, you're going to go in a denture. You're going to have these plastic pieces in your mouth that float around and kind of look like teeth, but can't function very well. And so that kind of held him back, that belief that maybe that's all he can do. But we have different options now. We can give you teeth that stay in, that you brush in your mouth, that feel like natural teeth and that function like natural teeth. And that's what we did for Dan.
It's a big difference in his appearance, for sure.
Big difference. And an attitude, too. He actually realized that he wanted to be in front of the camera, which wasn't an option before, right? Like you can't be in front of the camera with so few teeth. And he's doing great. He's actually living the life he always wanted, turns out.
What does he like more, the way it looks or what he could eat?
It used to be just what he could eat. That's what he thought he was doing it for. But I think now he's realizing what an impact that appearance change has for him, and just loves it. Comes in, and the dentist is his favorite place. And may I add, he was really scared of coming to the dentist.
Oh, is that right? Okay.
And it is a scary prospect.
Do you still hear that? Like, no offense, doctor, but I don't like the dentist.
Yes, we hear it all the time. And then I tell them, it's not me that you hate, it's the fact that you need dentistry. And then everybody laughs and they get their dentistry done. And yeah, they come in and they're relaxed. You can sense it when somebody comes into the room and they're apprehensive and they know they have to do something, but they don't really want to. And then later they feel like they've shed this weight. And every one of these patients has one regret.
What's that?
Which is that they didn't do it sooner.
Okay.
Either because they didn't know about it or because they just were fearful and something was holding them back. And they finally overcame it. And then later on they say, man, I should have believed it when I saw how easy it seemed.
Do you ever have spouses, partners, like one does it first, second one comes in?
Yeah, so the spouse is always our biggest ally. First, to get the person into the door, then to convince them that they're worth it, that we should really do this. And then afterwards, of course, to take care of them and experience this transformation of their partner. And then sometimes they need dental work too. And sometimes they need a full transformation like that as well, and they move forward with it, and it's a happy family, that's for sure. Okay, and then here I have Megan, actually. So Megan is young. She's in her 30s. And Megan came to me with a lot of pain, and a pain in her teeth, but also migraines. She was on 3 different migraine meds, and she got Botox in her neck to deal with her migraines, several migraines a week. And I said, well, Megan, we might be able to save your teeth. And she said, I'll wear dentures and have it done by another dentist if you won't do it, which made me aware of how desperate she was. And so
she wanted her teeth out.
She wanted all of her teeth out, and we could have, every tooth needed treatment, but we could have saved those teeth. And I'm, when you can save teeth, I'm a big proponent of saving teeth. But she knew deep in her heart that the teeth were a source of her pain, not just in the mouth. And so we did the procedure, and she has had 0 migraines since we did the procedure.
Right?
She's off her migraine meds, she's off the Botox injections, and she also, she's a beautiful lady, no matter what.
How do the teeth have anything to do with migraines?
So, good question. So they sit right by the sinuses, so teeth and sinus infections can be related, and then just the infection in the gums may have had that relationship to her migraines. We did this procedure in 1 day, and her migraines disappeared that day.
That's a good looking teeth, by the way.
Thank you. Well, I didn't do him. The tooth fairy made him. But but Megan is now a different person. When she was at the consult, she brought her husband. We always encourage a spouse or a loved one to come because they can hear stuff well, and they can encourage you to actually move forward with it, because people are just hesitant, right?
Yeah.
And she was very quiet. He did all of the talking. Because now when Megan comes in, she comes in and with relief that she's free from this pain. So when you look at her after smile, if you look at the photo here, you can see how we custom built her teeth.
They kind of perfectly fit her
That's right. The shape, the roundedness. So we would make a different shape for a young female than we would make for an older man, for example. We also look at your body proportions. We match it just perfectly so that it is aesthetically pleasing. So nobody is really thinking, oh, she has nice teeth, but you're thinking, oh, that she looks pretty, right? It's the whole. And people often that don't know you so well, when you do the procedure, patients tell me that friends of theirs say, hey, you got a haircut, or did you get a facelift? So they're not putting. They don't know what has changed. And in part it's the teeth, and in part it's the personality, right? That you love your smile, and you will look and act differently if you love your smile.
Very nice.
So it's gratifying for me to see how my team can use the technology to just make it perfect just for each patient. It's a custom design.
Your in-house tooth fairies that make the teeth.
That's right.
Now I'm going to rush you. You have a stack of photos.
I
know you wanted to show
so
you
many
those.
people.
So let's rush a little bit.
So this is William. You think cosmetic is for ladies, right? But for guys too. So William was already missing some front teeth. This is a bridge, and you can see in this photo, super nice guy, attractive man, but the teeth kind of jump in the room before him, right? Can we show the after photo here?
Yeah, nice.
So here in this after photo, he's wearing a similar shirt, the head is in a similar position, his haircut is the same, he's smiling the same, but now he looks so much more handsome.
Now
to me.
those teeth look real.
They look real. He looks
younger.
He
too.
looks significantly younger. I think he looks more fit. He looks smarter, and all of that because we just changed the teeth around. Nothing's changed.
And this guy could have ended up in a denture.
Absolutely, he would have had to. If we didn't have this, he would have had to. He genetically, he just didn't ever make very good teeth. He always went to the dentist. It's not like he didn't take care of his teeth. This guy invested lots of money into his oral health, and it just needed to have him out because they were just done. Now
we get a lot of questions about cost of this procedure. I guess even the best dental insurance doesn't really cover this. Medicare, Medicaid doesn't cover this.
Well, most people end up using a financial vehicle. They finance this and make.
You arrange this for them in the
Yes,
office?
absolutely. We help them with the application, and then you fit your payment into your monthly budget. I have a team that helps you with that. But we're also finding that some select health insurances, your PPO health insurance, your medical insurance, not dental insurance, is starting to pick this up. Yes.
Like a big portion of it?
Yes, absolutely. So your out-of-pocket is a fraction of what it used to be. And you can even finance that out-of-pocket portion. And it all depends on what your deductible is and what your plan is.
So they have to come in first for the evaluation to see if they're a candidate.
Absolutely. Okay. And so I have a treatment coordinator just dedicated to maximizing your medical insurance. So I want to show you a lot more patients here. Right. So here we have Jessica. Jessica's in her 30s. And so her teeth are getting very loose because she has an infection. And so in your 30s, would you want to wear a denture?
No.
Randy, it's not an option, right? You have so many more decades to live. So in just one day, we gave her 4 implants on the upper and 4 implants on the lower and secured some teeth on it. And she went home and she can now eat properly. The teeth aren't wiggling anymore every time she closes.
So a full arch of teeth on as little as 4 implants?
Correct.
Okay.
Yes.
Okay. I'm going to rush you because I know you have more to go.
I do. She's not my youngest patient. My youngest patient was in her 20s.
Wow.
Now,
she looks very young in this
Yes,
photo.
she's very young. Haley's parents succumbed to a meth addiction, but Haley never did any drugs. But if you look at her face, it looks like she may be. Her teeth are just really broken down. And in one day, we took out all of the upper and lower teeth, gave her implants, gave her a set of fixed teeth that don't come out.
Wow.
And look at the after photo, Randy. This is a week in between. This is a completely different person.
She looks more sophisticated.
She
like a different person.
Yes, she is a totally different person. Everybody in the office noticed it, and we just celebrate that. It's so rewarding to see when people, before Haley was scared to go on job interviews. Now she presents self-confident. She's speaking up for herself. Her diet is changing. She used to only eat mashed potatoes. So her bone was actually really soft because she had some nutritious deficiencies, actually. And a lot of people who make poor food choices make them because they have pain or their teeth are loose. Now Haley eats a proper diet, and she's definitely going on job interviews and putting herself out there. She has a whole new lease on life. So I'm so pleased that she was able to do this so young.
Now, you can't prove this, but do you think her life goes in a different direction because of this?
I see it already. The proof is in the pudding already. It's been about 3 months since we've done this, and It's a completely different person.
And just like teeth, if she takes care of them and goes on her checkups, they're going to last into her 70s or 80s or as long as she lasts.
She is very motivated now to take good care of them, and you do have to. You have to take care of them, and you have to go to the dentist a couple of times a year. And so then we have Beverly. Beverly,
wow.
Yes, you see the before photo, lovely lady, but she had a loose-fitting partial that kept coming in and out. The teeth were getting an infection. She needed a new set, and she looks completely different again. Now, she happens to be wearing the same shirt, and she happens to have the same hair, but look at the difference there in her eyes. She's smiling. To me, she looks younger. She looks smarter.
So upper and lower
teeth
supported by dental implants.
Correct, yes. Okay, so look at Emmy here. Emmy is a kindergarten teacher.
All right.
And Emmy had very little time to get this done because summer was almost over, and as you know, it's really difficult to actually take time off work when you have a class that you need to attend to. And so we squeezed it in. We saw Emmy, and 2 weeks later, she was in her new teeth and ready to teach kindergarten and start the new year. And you know what was really important to Emmy is that she got a natural smile. That it didn't look like she had gone to the dentist and got fake teeth. Right? So
they do look natural. I mean, they're not like perfectly straight across.
Correct. Like the ones in the center, yes. So the ones in the center are a little bit longer, and then the canines are a little pointy at the side, and it works with the curvature of her face, and it's straight, but it's not so perfect that it looks like a picket fence, you know, the fake ones. And we ask patients what they want, and we ask them to bring in photos so that they can really get that smile that they've always wanted, because it's a very personal thing, and we can absolutely custom create it for you.
We have about a minute left, and I know you have more photos.
I do. We have so many patients. So here's Alfred. He's a contractor, so he speaks to customers a lot. His upper teeth were loose and had to come out. We were able to save his lower teeth. Okay. But if you look at the before photo, he doesn't really know how to smile. And he's just really self-conscious of the appearance. And so in one day, we, instead of giving him a denture, we put in some implants, gave him his new upper teeth, and he's now learning how to properly smile. And
you say after a few compliments, they start
they start opening
smiling.
up. Sometimes it's such a habit that it takes a moment for people to realize what happened.
Okay, now we're out of time. So final message, somebody watching this, they're of the two groups you talked about. They have really bad teeth, and they feel like they're going to end up in a denture. They don't want a denture, or the denture wear.
Yes.
What do you say to them? They're skeptical. They've heard you. They've heard what you've had to say, but they're still afraid. What do you say to them?
I would say I totally get it, Randy. I understand that it's hard to make that first step, but they really have nothing to lose, right? Coming in and doing a consultation and finding out what the options are, what we can do for you, and what it would really mean. It makes all the sense in the world. Come see us and we'll discuss. And then if it's a go, 2 or 3 weeks later, you have your new set of teeth and you're starting your new life.
Do they always meet you?
They always meet me, yes, and I always do the surgery, and I will do the final teeth.
Because you're a local celebrity now.
Oh, well, thank you.
So, well, good for you.
Thanks to you, Randy, that's why.
Okay. So, would you prefer somebody make an appointment online or just call your office?
Call the office, talk to my lovely team, and we'll get you in as soon as possible for a free consult so that you can find out your options. There's no reason not to do it. Just call the office.
Dr. Jockin, always a pleasure to have you on the show. Good stuff. Thanks.
Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.